Man, age 64, PSA 8.3, terrified. Spent 2 weeks researching online. Everything said PSA over 4 is high. PSA 8 must be double dangerous. Started imagining worst-case scenarios. Went to urologist expecting one thing, biopsy immediately, possibly cancer, urgent treatment needed. Instead, urologist said something that stopped him cold. PSA 8.3 is not your danger zone. Let me show you what actually is. Man confused. PSA 8 isn't dangerous? Urologist. Numbers without context mean nothing. PSA 8 in some men is completely manageable. PSA 5 in other men is urgent. The number alone tells me almost nothing. Man. Then what does tell you? Urologist. 5 specific factors. These are what I actually look at, not the number itself. These 5 things determine whether you're in the real danger zone or not. Man got all 5 factors explained. Turned out he was not in the danger zone, not even close. But he learned what the real danger zone looks like. What would have made his urologist react very differently? Study from Journal of Urology. When PSA evaluated with these 5 factors, instead of number alone, biopsy recommendations changed in 41% of men. 41% were either over-recommended or under-recommended based on PSA alone. Today, we're revealing what urologists actually look at, the real danger zone after 60, the 5 factors that determine genuine urgency versus manageable concern. Because PSA 8 sounds dangerous, but urologists aren't looking at PSA 8. They're looking at 5 other things. This is medical education about PSA interpretation for men over 60. It is not medical advice or substitute for physician evaluation. Elevated PSA requires medical monitoring. Always consult your urologist about your specific situation. Individual risk factors vary significantly. Comment danger below for the free Real PSA Danger Zone checklist. Exactly which factors urologists watch for and what they mean. Link is pinned. Now the first factor, the one urologists check before anything else. Danger zone factor. Number 1, PSA velocity, the most important. Before looking at your PSA number, every experienced urologist looks at one thing first. How fast is it rising? This is PSA velocity, rate of change over time, more important than any single number. Study from Journal of Urology. PSA velocity is the single most predictive factor for aggressive prostate cancer, more predictive than absolute PSA level. The threshold, rising more than 0.75 nanograms per milliliter per year is concerning. Rising more than 2.0 per year is urgent. Doubling in under 18 months is the real danger zone. The man with PSA 8.3 had this history. 2 years ago, PSA 7.1. 1 year ago, PSA 7.8. Now PSA 8.3 rise per year, about 0.6 points, under the 0.75 threshold, not concerning velocity. His urologist. This PSA trend is almost completely flat. The 8.3 doesn't scare me because it's barely moved in 2 years. Contrast with a different patient. Same PSA 8.3 but different history, 6 months ago. PSA 5.2. Now, PSA 8.3, rise in 6 months 3.1 points, annualized, over 6 points per year, doubling time under 8 months. Same PSA 8.3, completely different urgency. First man, stable velocity, monitor carefully. Second man, explosive velocity, biopsy immediately. Research from Cancer Journal, PSA doubling time under 12 months associated with 4.3 times higher likelihood of aggressive, fast-growing cancer. Urologist to second man, this velocity is your danger zone, not the number 8, the speed of change. The question every man should ask urologist, what is my PSA velocity over the past 12 to 24 months? Not just what is my PSA today, but how fast has it been moving? Study from European Urology. Men who understood their PSA velocity made better informed decisions about biopsy than men who only knew their current PSA level. Factor 1. Velocity. Stable or slow rising means manageable. Rapid rise means danger zone. But factor 2 is what surprises most men, because it's a test many never knew existed. Danger zone factor. Number 2, free PSA ratio, the most surprising. Most men know about total PSA. Few know about free PSA ratio. This surprises urologists who consider it essential. Here's what it means. PSA exists in bloodstream in two forms: bound PSA, attached to proteins; free PSA, floating unattached. The ratio of free PSA to total PSA tells a critical story. Cancer cells tend to suppress free PSA. Non-cancerous prostate tissue produces more free PSA. Therefore, low free PSA ratio equals more likely cancer. High free PSA ratio equals more likely benign. Study from European Urology established thresholds. Free PSA under 10%, approximately 50 to 60% cancer probability. High risk, danger zone, free PSA 10 to 15%, approximately 30 to 40% probability. Moderate high concern, free PSA 15 to 25%, approximately 15 to 25% probability. Moderate concern, free PSA over 25%, approximately 10 to 15% probability. Lower risk, reassuring. The man with PSA 8.3 had free PSA test ordered. Result, free PSA 22%. Cancer probability approximately 18%. Urologist. Free PSA 22% is reassuring for your situation. If it were 8%, I'd be scheduling biopsy today regardless of everything else. Same PSA 8.3. Free PSA 22% versus hypothetical 8%. Complete change in urgency. Research from Journal of Urology. Among men with PSA 4 to 10, free PSA ratio correctly reclassified risk level in 34% of cases. 34% of men in gray zone had their actual risk reassessed when free PSA included. But here's what shocks men. Only 34% of men with PSA 4 to 10 actually get free PSA ordered before biopsy decision. 2 in 3 men go to biopsy without this information. The man asked his urologist, "Why isn't free PSA automatic with total PSA?" Urologist honest answer, "It should be. But it's a separate test, separate billing, and some doctors don't routinely order it. Now you know to ask for it specifically." The question, request free PSA ratio test when total PSA is elevated. Ask what your specific ratio means for your cancer probability. Factor 2, free PSA ratio. Under 10% is danger zone regardless of total PSA number. Over 25% is reassuring even at PSA 8 to 10. Factor 3 explains why 2 men with identical PSA and identical free PSA can have completely different risk profiles. Danger zone. Factor number 3, PSA density, the most misunderstood. PSA density is calculated by dividing your PSA by your prostate volume. PSA divided by prostate volume in milliliters equals PSA density. Threshold, over 0.15 is concerning. Under 0.10 is reassuring. Why does prostate size matter? Larger prostate naturally produces more PSA. If prostate is 80 grams, PSA 8 is expected from size alone, not cancer. If prostate is 30 grams, PSA 8 is too high for that size. Raises concern that something else, potentially cancer, is producing excess PSA. The man with PSA 8.3 had prostate volume estimated at 70 grams on imaging. PSA density, 8.3 divided by 70 equals 0.12. Borderline, but not clearly concerning. Urologist. Your prostate is large. A 70-gram prostate regularly produces PSA in the 7 to 9 range just from its size. Your density of 0.12 is acceptable given everything else. Contrast with different patient. PSA 8, but prostate only 30 grams. PSA density, 8 divided by 30 equals 0.27, well above 0.15 threshold. Urologist. Your prostate is small. It shouldn't be producing PSA 8. Something is driving this beyond just prostate size. Density of 0.27 is my concern here. Research from European Urology, PSA, density above 0.15 predicted cancer on biopsy, with 72% accuracy in men with PSA 4 to 10. PSA density below 0.10 predicted benign cause with 78% accuracy. Men with high PSA but low density often have BPH as explanation. Men with normal range PSA but high density may have cancer despite seemingly acceptable total PSA. The man with 70-gram prostate, density 0.12, borderline reassuring. The other man with 30-gram prostate at PSA 8, density 0.27, danger zone. The question: ask urologists to estimate prostate volume and calculate your PSA density. You deserve to know this number. Study from Journal of Urology. When PSA density added to clinical evaluation, unnecessary biopsy reduced by 28% in men with PSA 4 to 10. Factor 3. PSA density. High density with any PSA number is danger zone. Low density is reassuring even with higher PSA. Now let me show you how these three factors combine to paint the complete picture. The man with PSA 8.3 now had all three factors evaluated. Velocity, 0.6 points per year. Under threshold, reassuring. Free PSA ratio, 22%, over 15%, reassuring. PSA density, 0.12. Borderline but acceptable given large prostate. Digital rectal exam, large, smooth prostate, no nodules. Age, 64, otherwise healthy. Life expectancy, 20 plus years. Overall picture: 3 reassuring factors, 1 borderline, 1 neutral. Not in danger zone, but not fully reassured either. Urologist recommendation: MRI next. If MRI shows no suspicious lesions, monitor every 3 to 4 months. If MRI shows something, targeted biopsy. The man got MRI. No suspicious lesions identified. Started active monitoring. Now let me show you what the real danger zone looks like by comparison. Different patient, PSA 8.1, velocity, rose from 4.8 to 8.1 in 10 months, 3.3 points, annualized over 4 points. Danger zone, free PSA ratio, 8%, below 10% threshold. Danger zone, PSA density, 8.1 with 25-gram prostate. Density 0.32, well above 0.15. Danger zone. Digital rectal exam, small firm area palpable on left side. Same PSA number as first man, 8.1 versus 8.3. But 3 of 3 factors in danger zone. Urologist recommended immediate biopsy. Result: Gleason 7 cancer found, localized, treated successfully. Study from Prostate Journal, combining velocity, free PSA, and density into composite risk score, correctly identified high-risk patients in 89% of cases. PSA alone correctly identified only 52%. The difference, 89% versus 52% accuracy. Knowing all 3 factors nearly doubles diagnostic accuracy. This is why urologists wish their patients understood these factors, not just the PSA number, the complete picture that the number is part of. Man 1 with PSA 8.3 and 3 reassuring factors. No biopsy needed yet. Monitoring. Man 2 with PSA 8.1 and 3 concerning factors. Immediate biopsy. Cancer caught. Same PSA. Opposite situations. Opposite outcomes from appropriate diagnosis. Important balance. After discussing what the danger zone is, equal importance to clarify what is not the danger zone. Urologists see unnecessary anxiety constantly. Men convinced they're in crisis when they're not. What urologists do not consider the danger zone. Stable PSA in gray zone for years. PSA 8 sitting at 7.8 to 8.2 for 3 years, with reassuring free PSA and normal exam. This is monitoring territory, not panic territory. Elevated PSA with very large prostate. PSA 10 in man with 90-gram prostate. Density only 0.11. Likely benign enlargement. Not immediately concerning without other risk factors. Temporary PSA spike. PSA 9 after cycling, vigorous exercise, recent ejaculation, or prostate manipulation. Retest in 6 weeks after abstaining from these activities. Spike may not be real baseline. PSA elevation with active prostatitis. Prostate infection can spike PSA dramatically. Treat infection first, retest. PSA often drops substantially. PSA rise on finasteride that's actually normalized. Finasteride halves PSA. If on finasteride, multiply PSA by 2 for true comparison. PSA 4.5 on finasteride equals effectively PSA 9 adjusted. High PSA with low velocity and excellent free PSA ratio. All 3 factors must be considered. One elevated factor alone rarely justifies panic. Research from European Urology. Among men with PSA 8 to 12 who met criteria for reassurance, stable velocity, good free PSA, low density, 77% had no cancer on eventual biopsy. 77% in that reassured category were not in danger zone despite seemingly high PSA. The man with PSA 8.3 fell into this category, not in danger zone. Monitored appropriately. 2 years later, PSA 8.4. Essentially unchanged, still monitoring, still not in danger zone. He avoided unnecessary biopsy based on complete picture, avoided anxiety based on understanding. Study from Journal of Urology. Men who understood their complete PSA picture, rather than just total PSA, had 43% lower anxiety scores and made more appropriate decisions about biopsy timing. Information reduces fear. Complete information reduces it dramatically. Here's what urologists wish every man over 60 with elevated PSA understood. The number is the least important part of your PSA story. The real story is velocity. How fast is it moving? Free PSA ratio. What does the ratio tell you about cancer probability? PSA density. Does the number make sense for your prostate size? Exam. What did the urologist feel? Age and health. What are the life expectancy considerations? The man with PSA 8.3 had 3 reassuring factors. Not in danger zone. Monitoring appropriately. A different man with PSA 8.1 had 3 concerning factors. In real danger zone. Got biopsy. Cancer found and treated. Same number, completely different situations, different appropriate responses. Study combining all factors. 89% accuracy in identifying real danger. PSA alone, 52% accuracy. Comment danger for your free checklist showing all 5 factors and what each means for your risk level. If this clarified PSA interpretation, like and share with men confused about elevated PSA. Subscribe for next week's video on the MRI test that prevents unnecessary biopsies. Critical reminder, this is medical education about PSA interpretation, not diagnosis or treatment advice. Elevated PSA requires physician evaluation. Your specific risk depends on your complete clinical picture, which only your doctor can assess. But knowing these 5 factors means you can have better, more informed conversations with your urologist. PSA 8 might not be your danger zone, but only when you know all 5 factors can you truly understand where you stand. Velocity, free PSA, density, exam, age, 5 factors, complete picture, real understanding, starting with your next urologist appointment.